Gentlemen, today I'm answering the question that dozens of you have asked privately. The one men search for late at night but never say out loud. Is oral intimacy safe? What about taste, smell, and health concerns? This is educational medical content for adults. I'm Dr. Amara Cruz, board-certified urologist, and today we're having an honest, science-based conversation about intimate health that most doctors won't discuss openly. Before we dive in, hit like, subscribe, and comment where you're watching from. Now, let me share something that happened this week that reminded me why these conversations matter. The comments you leave on my videos truly make my day. I read every single one. Recently, a female viewer shared a personal story about how these open conversations helped her and her partner reconnect after years of avoiding intimate topics. Her courage to share that meant the world to me. Thank you. This is exactly why I do this work, because life gets better when we share, learn, and support each other without shame. I appreciate every one of you. Now, let's get into today's topic. Here's the truth most men don't know. Oral intimacy is one of the most intimate acts between partners, but it's also one of the most misunderstood. And that confusion creates fear, hesitation, and sometimes shame. I've counseled men in their 40s who avoid oral sex entirely because they don't know if it's safe. Men in their 60s rediscovering intimacy after divorce, terrified to ask basic health questions. Long-term couples who've never discussed this openly, letting silent worries erode connection. The questions are always the same. Is it safe to swallow vaginal fluids? What if the taste or smell seems off? Could I get sick? How do I talk about this without hurting her feelings? These aren't trivial concerns. They affect confidence, pleasure, and emotional intimacy. And the worst part? Most men carry these fears silently, never getting real answers. So, let's break the silence. Let's talk science, safety, and respect. First, let's clear up the biggest myth. Myth: vaginal fluids are dirty or dangerous. Wrong. For healthy, infection-free couples, vaginal fluids are generally safe. Here's the biology. Vaginal lubrication isn't just wetness. It's a sophisticated mixture produced by multiple glands. The Bartholin's glands release fluid to reduce friction. SK's glands near the urethra contribute additional lubrication. The cervix produces mucus that changes throughout the menstrual cycle. This fluid serves critical functions, protects delicate vaginal tissue, fights off harmful bacteria thanks to lactic acid, maintains optimal pH balance, facilitates comfortable, pleasurable sex. In other words, vaginal fluids are the body's natural defense system, not something to fear. But here's the key phrase: healthy, infection-free couples. Safety depends on two factors: health status and communication. Let's break that down. Factor 1, health status. Vaginal fluids are mostly water, amino acids, enzymes, glucose, and lactic acid. Protective and natural. But like any bodily fluid, semen, blood, saliva, they can transmit infections if present. This includes chlamydia, gonorrhea, herpes, and HIV. The risk from oral sex is lower than penetrative sex, but it's not zero, especially if you have cuts in your mouth, bleeding gums, or open sores. That's why health screening matters, not as a mood killer, as a foundation of trust. Factor 2, taste and smell. Variation is normal. Many men panic when taste or smell changes, but here's the reality. Variation is completely normal. What affects taste and smell? Diet, pineapple, berries. Hydration, lighter, fresher. Garlic, alcohol, coffee, stronger. Menstrual cycle around ovulation, more abundant and neutral. Around menstruation, slight metallic tang. Hormones. After menopause, sometimes less lubrication, slightly more acidic. Hydration. Dehydration concentrates taste. Medications, birth control, antibiotics can shift chemistry. None of this is wrong. It's biology. The only time to worry: sudden unpleasant changes with itching, burning, or unusual discharge. That usually signals a minor imbalance. easily treatable with a doctor's visit. Factor 3, communication is mandatory. This is where most men fail. They stay silent, hoping the issue goes away. It doesn't. If something feels off, taste, smell, discomfort, address it with kindness, not criticism. Wrong approach. Something's wrong down there. Right approach. Hey, I noticed something different. Should we check in with a doctor together? When you approach intimate health as a team, not a problem with her. Trust deepens. Factor 4, testing isn't unromantic. It's essential. I once treated a man in his 60s. New relationship. After oral sex, he panicked because he had bleeding gums. He was terrified of HIV. The risk was low, but his fear was real. He and his partner got tested together, both negative, and the process, vulnerable, honest, responsible, brought them closer than any romantic gesture could. Testing isn't a mood killer, it's respect. Make STI screening a routine health ritual twice a year or whenever you start a new relationship. Factor 5, acceptance over judgment. Here's the most damaging mistake: responding with shame. If something smells different or tastes stronger than expected, many men recoil, joke, or criticize. When you do that, your partner feels rejected. Intimacy shuts down. Instead, suggest a shower together before intimacy. Make it playful, not clinical. Encourage hydration and a balanced diet. Normalize the conversation. Bodies change. It's natural. Acceptance is the most powerful aphrodisiac. When a woman feels fully accepted, her arousal deepens, trust expands, and intimacy becomes more powerful for both of you. Here's your actionable plan for safe, enjoyable oral intimacy. Here's your actionable plan for safe, enjoyable oral intimacy. Get tested together. Make STI screening part of your routine. It's respect. Communicate before intimacy. Ask, is there anything I should know about your health? Normalize these conversations. Prioritize hygiene. Shower before intimacy. Stay hydrated. Eat well. What you consume affects taste and smell. Watch for warning signs, sudden changes with discomfort. See a doctor together. Protect your mouth. If you have cuts, sores, or bleeding gums, wait until healed. Embrace acceptance. Every body is different. Celebrate that instead of comparing to unrealistic standards. Here's what most men miss. Oral intimacy isn't just physical, it's trust and vulnerability. When you approach your partner with curiosity and acceptance, not fear or judgment, you create safety. And safety is the foundation of pleasure. I've worked with couples in their 70s whose intimate life improved with age. Not because their bodies were better, but because they learned to communicate and accept each other fully. You don't need youth for incredible intimacy. You need presence, honesty, and kindness. Let's address common concerns. What if I taste something I don't like? Taste varies naturally based on diet, hydration, and hormones. If it's mild and temporary, that's normal. If persistent and concerning, suggest a doctor's visit together as a team. Can I TI? Yes, it's possible, but the risk is lower than penetrative intercourse. Regular testing and good dental hygiene make it safer. What if she's embarrassed to talk? Lead with vulnerability. Say, I want us to feel comfortable together. Can we talk openly about health? When you model honesty, she'll follow. Is swallowing safe for healthy, infection-free couples? Yes. Vaginal fluids are primarily water, natural, enzymes, and protective compounds, not harmful. Mistake 1, assuming silence is safer than conversation. Wrong. Conversation builds trust. Mistake 2, reacting with disgust. Your reaction determines everything. Respond with curiosity, not criticism. Mistake 3, skipping testing because we trust each other. Trust is emotional. Testing is medical. Both matter. Gentlemen, here's the bottom line. Oral intimacy is safe when you prioritize health, communication, and respect. It's something to enjoy fully with knowledge and confidence. Is it safe for healthy couples? Yes. Is variation normal? Absolutely. Can you protect both partners? Yes. through testing and communication. The real secret isn't perfect technique, it's trust, acceptance, and honest conversations. If this helped you, like this video, subscribe for weekly men's health advice, and comment. What's your biggest intimate health question? Remember, intimacy is emotional, mental, and spiritual. When you approach your partner with wisdom and openness, you create connection that lasts a lifetime. I'm Dr. Amara Cruz. Take care of yourself. You deserve nothing less.